Now we should be good.
Yeah, no, you're.
All right. Hi, everybody. Thanks for bearing with us. We're a few minutes late. I'm Betsy Freeman. We're talking about choosing a therapist. Today, I'm coming to you live from Vancouver, Washington, and my guests are across the country. I have Dr. Emma Church with us, Maia Akiva, and Emerson Gregory. And I'm going to let each of them introduce themselves and their connection to this very important topic. Emma.
Hi, I'm Dr. Church, and I'm a licensed clinical psychologist. I have a private practice in Waco, Texas. And my connection to this topic is not just in that I am a therapist and I have been a psychologist for 11 years, but I was first a patient. So I've been a patient for about 20 years and a psychologist for just about 11 years. And I think this is a really pertinent and important topic to be speaking about today.
Absolutely. Emerson.
Hello, I'm Emerson Gregory. I'm an actor and healthcare worker in Los Angeles. My personal experience with this topic is that my parents got divorced when I was really young, and I started seeing a therapist at the age of, I think I was like 6. And so for my life, therapy has been a big part of it. I actually was fascinated by therapy as a child, and so I've read a lot of books in psychology. I've also gone back to the therapist a few times as an adult, and my job in healthcare, I work in the emergency room, and so we have patients that come in, a lot of patients with suicidal ideation, and so in their healthcare journey or in their mental health journey, a lot of times I see them see people at their hardest times or some of their hardest times.
Thank you. Maia.
Hello, I'm Maia Akiva. Whenever I work in mental health, and that's my major occupation, I always start with, my name is Maia and I'm not a therapist. So people, because I sit in a room where therapy is supposed to sit. So I always like to start with that. Besides, like Emerson, I've been a patient of mental health all my life, and I've done many different modules and therapy. I also work in mental health. I have a company called Mental Health Plus Creativity Content and Programs, and I produce and create mental health creative programs like my podcast, which I interview my feelings every episode. It's kind of like a fictional podcast. And then right now I'm also teaching a creative writing, a mental health creative writing curriculum that I created in mental health and addiction treatment center, and about to start training therapists on how to do that that curriculum. So I'm like, even though I'm not a therapist, I'm very involved in this world as a patient and a client, and as somebody who sits in the room and work with a lot of mental health.
Yes, I have been to really only one or two of Maia's groups that she hosts. She also does creative coaching, and she employs a lot of the same sort of techniques that she facilitates. And it's been really wonderful to have such an accepting and kind presence to help work through some of our own creative blocks as well. So I'm Betsy Freeman. I have a little booking business that's only a couple of years, 2 or 3 years old. And Maia's been one of my clients since the beginning. In non-pandemic times, we go out and do live event things, and I help book speakers, and I help book singing gigs for musicians and all that kind of fun stuff. And in other times, we do online events. All year round, we do all the time we could do online events. So I'm really happy to talk about this season, because as we all have to we all need therapy in some sense. At the very least, you need good friends to hear you and to sit with you through difficult times. And there's lots of factors that go into choosing a good therapist. I think the first time I saw a therapist was when I was 16 or 17 for depression. Probably just went in to get a prescription, didn't take the prescription after it didn't agree with my breakfast. But then found myself really needing more acute help in college and a couple of other times since then. But I've had some really great help from therapists in the past 15 years, especially since I moved to LA and really needed help with adjusting to being an adult living in a big city that was often unfriendly and way too expensive. So, alrighty. So we have some great questions that actually Emerson and then I wrote questions about what should your relationship with your therapist feel like? That's the first one. So we'll go to Dr. Church first to answer that one.
Yeah, I think so. This is a really, really important component of therapy is the therapeutic relationship. And, you know, we have an intuitive sense, I think, of when we feel connected and safe and comfortable with a person. But not everybody knows that that's an important piece of being with your therapist. It's not just being with a surgeon or somebody who's going to remove a mole. You want to feel a strong sense of connectedness with your therapist. And so as a patient, I've had experiences with different therapists over the years with different relational connection, different ability to feel understood and really seen where I am. But as a therapist, it's become very important in my own work. I'm very relational with my patients, and I find that that is the number one vehicle for change and for healing and for positive outcomes. And so how I would describe myself as a psychologist, you know, I'm not the psychologist for everybody, but I think for my patients, the way that they feel in relationship to me is a very important part of our work together. And I would say that it is very, very similar to a close friend, or maybe even a best friend, or maybe even being best friends with yourself, to have a space where you can say pretty much anything and everything, no matter how egregious or horrible you think it is, how severely you might judge yourself, to know that your therapist is going to be there as a compassionate and understanding listener. I do love my patients, which can be controversial to say as a psychologist, but it is true. I think it's, for me, part of what makes me good at what I do. I'm very invested in them and in their lives. And we laugh and I cry with them. And I know about their lives. I know about the players in their lives, their siblings, their significant others. And so, you know, some sessions are rough because we're dealing with difficult topics. And there's a lot of tears and a lot of anxiety, I think, with my patients, just kind of coming into a space where they are invited to be very honest with themselves in front of me. But they know that there's nothing that they can do or say that will make me love them any less or think any less of them. And so there is a really close bondedness in relationship that I think is very, very important for significant healing work to happen. I think it also really depends on what you're looking for. So, you know, if you have depression and you're looking for some coping skills, you may not need that deep love, friendship, connection. And it is a professional relationship. You know, there are boundaries there. But from a felt sense, I think that if you are doing intense work or work that is maybe lifelong or has been going on for some time, that you feel like you look forward to being with your therapist. It's normal to have some anxiety about sessions because you don't know what's going to come up and you don't know what to say and you don't know what they're going to say, but to look forward to that comforting relational space, I think is kind of the gold standard for what I would want for any of my friends and family seeking therapy.
Thank you. Maya, do you want to answer that one next?
Sure. I think like to me, what comes up is safety. Safety to me is the number one like requirement experience in mental health in general, because opposite physical help in some ways, mental health cannot be seen. It's you can only communicate what you are experiencing. And if you don't feel safe, like you are being understood or believed or whatever it is, it can just shut you down, and you can not, you know, not want to take care of yourself or not use what's use the therapy and the work. So that's, to me, is the number one thing. It is definitely safety. I know, and like when I go to treatment centers, like I always always explain that this is a safe place. Nobody has to share about anything they don't want to share. If they're too triggered, like they can, their safety is the number one important in their journey of healing. As a client who's been to many therapists, like a lot, and also for, again, different like modalities, right now, besides safety, I find that I want to get my money worth. And I don't mean it in a bad way, but meaning I pick therapists now with a specific need that I have. It's not just talking to somebody, and I need them to fulfill the need that that I understood they are able to give me. It can be, EMDR, somatic work. It could be even talk therapy, emotional talk therapy, whatever it is. But that's very important to me from a client point of view.
That's really important. Safety is key. Emerson. Did we lose him? I'm not sure if he's frozen just for me or for everyone.
Yeah, he's frozen.
Okay, so I'll jump in and say, for me, it's different things at different times. The therapist that I had for most of the time in LA, I was a pretty sporadic patient, and I would wait until things got so bad in some relationship, usually with my roommate or a job problem, where it had gotten to be such an emotional strain that I no longer could figure out how to fix it. And probably, that's not how I recommend anyone should do therapy. You should not let it get to that point. You should be able to check in on a regular basis, and maybe not for, not every week necessarily. Doesn't have to be. It could be, once every 2 weeks, or maybe once a month if you're busy or whatever. Everybody's different. But at the same time, I had a therapist who was able to just give often an affirming, like, you're gonna be okay. I think that was like the main lie that I believed, especially in my 20s and early 30s, was that there might be some like point where I would just get totally kicked out of society and never be okay again, basically. And she was able to pick up on that, even though I never said that, because it was too deep for me to really get it out in one session. She'd just be like, I'm always here for you anytime. She didn't say it quite like that. She didn't have the accent, but anyway, I'm always here for you anytime you need me. And she'd just say it with a smile on her face, and that's what she would say. So sometimes, she'd give me ideas and help me analyze the situation, whether it was with my family or a roommate or a boss, or help me come up with ideas about what was the career I really wanted, what was I going to do to get to the next step. But mostly it was just that here's this other person in my life who's completely outside of the situation, doesn't know any of these people, but she's on my side. She's my advocate. She doesn't have to know all the horrible things I've done in my life. She doesn't need to know the backstory for every single thing, but she can be with me and present right now and be my listening ear right now. Because that's a really hard burden to put on your friends or your roommates or your family members. They can't always be there to shoulder that stuff for you. And that's why having a therapist is really helpful. One of the many reasons. Well, I am not sure what happened to Emerson, but I hope that he can make it back in and we can see him whenever he tries to re-enter. So we'll go on to the next question. And when he comes back, we'll ask him that first question again. Let's see. So let's do that as the next question. What demographics should you consider when considering a therapist, i.e. sex, age, religion, race?
Okay, so I'll take that one. Let me just piggyback a little bit off of our last question to kind of highlight more about the relationship before heading into demographic stuff. One of the predominant philosophies or theories that I follow is called the common factors approach. John Norcross is the theorist who did a meta-analysis of many different types of psychotherapy. So I think cognitive behavioral therapy, CBT, is probably the most well-known amongst lay people. They may have heard of it. But there are lots of different orientations and ways to approach mental health issues within therapy. But within his meta-analysis, he showed that the most important factor that is controlled by the therapist outside of their orientation is the quality of the relationship. So about 30% of positive outcomes in psychotherapy have to do with the nature of your relationship with your therapist, which is why it is so important. And Emerson's back, so maybe he can speak a little bit more about relationship.
Welcome back.
Sorry about that. My internet just decided to not be alive anymore. Where were we? What's going on?
What should your relationship with your therapist feel like, Emerson? That's where we were. We went on to the next question, but we're coming back to you because we want to hear your answer.
Oh, great. Well, I thought that both of your answers were so very thorough. You need to feel safe, and you need to have trust. And you also need to feel empowered in that room. I think that what's interesting about therapy is that you are approaching a place of, for many people, you're approaching a place where you don't feel very empowered. And so there's a sense of powerlessness when you talk about a lot of these things, because there are places that don't feel safe for you, because in the narrative of your life, they weren't safe events. And so going through them in this relationship, it's not going to feel safe because of the content, but ideally the person that you're going through them with, it should feel safer because of that person. You shouldn't feel judged by them. And you may project something on them that makes you feel judged despite the fact that they're not judging you. But there could be a sense that maybe they remind you a little too much of your dad, and that's not going to go away, you know? And so you kind of have to be honest with yourself and figure out what the criteria you need to feel safe in that room with that person to the utmost quantity, because there are other elements that are happening in that room that are going to make you feel unsafe because of what you're doing.
That's good. That's really important what you just added, which goes on to the next question, which Dr. Church was just addressing, about demographics that should be considered. Let's let Emma continue that, and then we'll come back to you, Emerson, on that.
So in terms of demographics, I think there's quite a bit of research that has been done to investigate matching between patients and therapists in terms of things like race, gender, and even things like sexual orientation, which may not be visible, but may be advertised as something that is relevant on somebody's marketing in some way. But the research is pretty spotty. It doesn't quite show that you need to have somebody of your same demographic to be your therapist to have it be effective. And so, you know, that's a good thing in that we still struggle so much in our culture with access to higher education, things like degrees that would give you the ability to have a license to be a psychologist, and those being more accessible to people of privilege, people with white skin in our culture. And so if you're a minority person looking for a therapist and you feel the need to, or if the research indicated the need for a match there, then you might be out of luck. So the good news is that it isn't necessary to have an effective therapy relationship with someone to have a matching of your demographic with them. Now, I would say as both a patient and a practitioner, I come from a multicultural therapy background, and so have quite a bit of education in understanding my patients through the lens of their different oppressed identities. And that's not a given for every therapist. So I would say if you do feel that it would be important to have a therapist that is understanding of your unique demographic, that they may not represent that, but if you're looking online for a therapist, to look for someone who has a multicultural therapy background. Or more specifically for myself, my lens would be multicultural through the lens of a feminist psychology background, which I also work with men and men's issues, but it's really looking at different identities that have to do with oppression and lived experience in our world. So you may have depression as a minority that is not biologically your own, but depression that is caused by the environment in which you exist. You know, as a Black person in America, being pulled over by the cops is not an uncommon experience and may cause anxiety. And so instead of saying you having an anxiety disorder, a multicultural therapist will be able to see, yeah, you have anxiety that is very warranted given your lived experience, and it can depathologize you as a patient going in to see that person if they have a multicultural or feminist psychotherapy lens. So I'd say if you can find someone who's a match and that makes sense for you and is accessible, that's great. But if not, looking for that multicultural therapy background, feminist psychotherapy, some of the more fourth wave therapy backgrounds can be helpful.
Great. Emerson, you were saying a little bit about roles and what someone might remind you of, but what other demographics?
So, I mean, personally, when I went to see a therapist a few years ago, I was dealing with specifically issues with my mom and just prejudices that I had personally against women, at least in a romantic context, because of experiences that I had with my mom. So I chose a female therapist because I thought it could help me to it could benefit my sense of rationale in women, and it would help me to create more healthy, romantic, intimate relationships. And it was very successful, just because I chose that demographic. And so I would say, consider what you want to get out of it. You know, if you have trust issues with men, maybe you're not ready to have a male therapist, or maybe you are ready to have a male therapist, and that might be instrumental in helping you to overcome it. It's something to consider, and that's just how I approach it. Yeah.
Good. And Maya, before, I just want to mention Maya has at least 1 or 2 fans watching, so thank you for bringing your friends. I know that you all probably have friends watching. I try to watch out for anyone who might comment or leave a question. Some weeks I'm like more preoccupied than others, but I am trying to watch. So if you have a question or a comment as an audience member, as a viewer, please feel free. Maya?
I think Emerson internet came to visit me because I got frozen for a few minutes there, so I apologize. Yeah, I mean, I again, piggybacking, that's what you said in English, on what Emerson said. I believe it's like a personal responsibility thing, meaning I know it might be a catch-22, but you have to know yourself and what you want and what you need. Some people can only work with therapists who share their values, morals, sexuality, beliefs, and some people couldn't care less. Some people can work with any gender. Some people need a specific gender. I think it's find out what is comfortable for you. It might be a little bit of trial and error. You might have to go through a few therapies or try a few or have consultation with a few to figure out what works for you, or talk to your friend or talk to people who have done therapy before. But basically it comes down to what you need, you know, what are your needs, and that's what you go by. Like I choose now based on modalities, price and modalities. Those are my two now. Before it was safety and refers, you know, so it's kind of like depends on what your needs are.
Absolutely. Yeah, thank you for that. Yeah, I'm not, there's certain modalities that I'm interested in learning more about, and some that I know absolutely nothing about. For me, I've always looked for an affordable Christian therapist, and there's been different times when one gender or age seemed more appropriate than others. But I've never been, you know, like, well, are you Baptist or Lutheran, or, you know, do you believe in this or that? And actually I found that, you know, it's not so important to me to have someone, you know, quoting scripture or praying as part of therapy, and actually could be harmful when it doesn't feel, it's not the right fit, you know, just like going to a church service and having someone pray for you. Sometimes they just say something that's completely inappropriate to what you need to hear right now. And so that to me is a generational thing as well. Like we receive, you know, advice or, you know, good listening conversations in, you know, different ways in different generations. And so as I'm seeking now, that's sort of like my criteria is like, okay, they could be younger than I am, but probably not more than, 5 or 10 years younger than I am. And but if they're too much older, probably it's not going to work, because I really need somebody who understands boundaries. Like probably the most important thing is I need someone who's going to help coach me on like when I'm being too hard line with my boundaries, and when I, need to hold the line. That's honestly, that's I think the biggest thing that I've been working on in the last, maybe my whole life. Might be my most important growth process. So everybody's different. All right, thank you all. That was a great question. I learned a lot. How do I know when it's time to switch therapists or to try someone new? Will I hurt my therapist's feelings if I decide to leave them? Okay, so we're gonna switch it up eventually, but I still want to go to Emma first on this one because she's a therapist.
She's the doctor. She should always go first.
Oh, I don't know about that, but I do have lots of thoughts on this. I will tell my patients that I get really excited about the day that they are angry with me and share that with me. It has very rarely happened. I think potentially in my career only twice, but that to me is an indicator of their safety, that they are willing to say, I'm not getting from you what I'm needing, and I'm pissed about it. And I usually do like a little celebration. My patients are very well versed in seeing my different body movements. I'll clap for them. I'm like, I'm so glad that you told me that I'm not doing a good job for you because I want to. So again, that I think is indicative of the type of relationship that I would hope that most people get to have with their therapist, is that level of comfort. But you may not have that level of comfort, and that may be part of the reason that you're needing to switch. A lot of times, as a patient myself, going in and kind of feeling like you're hitting your head against the wall, you're saying the same things over and over and over again, and not a whole lot is changing in your life. Potentially you don't see any sort of recognition from your therapist that they understand what it is that you're describing to them or what you're going through. I would definitely say that invalidation in terms of, well, this is just something you need to get past or get over, or we'll stop thinking that way. Those are some of, I would say, the most egregious things that a therapist can say, and yet it's not uncommon. And so if you are getting that sort of feedback from your therapist, it is not a you problem. It is that therapist is not equipped to help you, and there is help to be found. I think the thing that frightens me the most for the populace in terms of therapy experiences is that they may come away thinking, I'm too broken to be helped. That is never the case. If you are feeling that way, it is because you are with the wrong therapist and it's time to find somebody else. And again, I think modalities and other criteria are important. But really for me, if I am to guide anyone, it would be that felt sense, that felt quality of the relationship. Do I feel understood? Do I feel cared for? Even from session one, do I feel a sense of compassion towards me, a curiosity about me? And that if you are hitting a wall with your therapist, to look for a therapist in which you feel that connection. Because you know what, as a psychologist, I don't know everything. I know lots of things, but I don't know everything. And the patient is the expert of their experience. And so I really rely on my patients to help me in my curiosity understand what it is that they need and where they're coming from. But that is a quality that I bring, that I think other therapists bring and can bring if the person that you're working with is not able to be curious and kind of shift lenses and work with you to find progress and comfort.
Good. Maia?
Yeah, pretty much. I mean, very similar to what Dr. Church says. I mean, I left therapies from all of the above reason, everything you said, Emma.
Just because it's, just for anyone new that's joining us, could you restate the question, or should I?
Yeah, if you don't mind doing it.
How do I know when it's time to switch therapists? How do you know, or to try someone new? And will I hurt my therapist's feelings if I decide to leave them? Sorry about that.
Yeah, no problem. Thank you. I would have failed that memory test. Yeah, I left therapists. I didn't say quit and left therapists from all of the above reason. Money, time, they were bad. I was done with the modality. I don't do confrontation, so I always don't like to leave therapists, but it's a good practice in learning, to me, in learning how to do it, and taking care of myself. Obviously, if you have a therapist that has a bad reaction, then good for you for leaving them. That was a good decision. That is not okay. And you can always report therapist if I'm not, correct me if I'm wrong, but you can always report therapists and, but that's like hardly happen. Most therapists are great people. It's really like you can see it as a practice in vulnerability for yourself in a safe place. Learn, you can talk to your therapist about it, how, you can make it into a session. But the bottom line is, it's your mental health and it's your journey. And, sticking with a therapist just because they're your therapist, it's like, sticking in a relationship just because you're in a relationship. It's not a good practice. And always think about what you need, what your needs are, what your well-being. And I also tell myself that I can always try to go back to the therapist. Let's say I figured out I made a mistake, or I couldn't find another therapist and I decided it's actually was being smart to work with them more. If they have an opening, I won't have a problem saying that's like actually my safety space of like, I can leave something, but because it's a professional relationship, I can always ask to go back to. You can always ask for recommendations, meaning like, don't forget, the bottom line is it's a professional relationship. So it's not, it's not, even though it might feel uncomfortable, it's not like living a personal relationship that there could be like hurts and problems.
Absolutely. Good. Christina is watching us. I just want to say hi. Do you remember Christina from the conservatory back in the day? Sabrina. It was so exciting. All right. I'll jump in real quick and say, if you go to therapy sporadically, like I had done, really last year was the first year that I was like, okay, it's January 2020. Of course, I didn't know about the pandemic, but I was like, the last few months have been crappy and I should have let myself get to this place again. I should have regular therapy. So I was doing that and that was great. However, then I moved. Then I had to find another therapist and I failed at that. Like I still haven't found a Washington State therapist. She was willing. My California therapist can still do like a few phone sessions. I discovered that phone sessions are really not good for me, which is surprising. So I think that whenever you don't feel really heard or listened to, or understood, when you feel like exhausted from the session, rather like if you spend more time trying to explain the scenario, of course, like there should be a reasonable amount of time. Like there was one person I tried with this last year who, after the first session, I just had this sense, I prayed about it and I felt like maybe it was after the second session, like don't go back to this person but I didn't listen. I still went back for a third session. And of course, then after that, I was like too worn out to keep looking for a new person. And there's nothing wrong with him. It wasn't his fault. It was just that he couldn't tune into my situation to give me any insight or understanding that was worth my hour. And that's the only way I know how to explain it. It wasn't about cost. It wasn't about any of that. It was just like, I didn't get anything new. I just listened to myself talk. And then he said some things that made me feel more burdened instead of like my burden was lightened. And that's no way to feel after a therapy session. Like, yeah, I think that some sessions might wear you out because you're reliving pain or something like that. And you might need to, sleep after that, but that's different from feeling like this person just doesn't get me like on any level at all. So Emerson.
So I think I think what's important to consider is what your goals are in therapy. And sometimes your therapist has different goals. And sometimes that's something that goes uncommunicated. And your goals might change as you're going through your therapy experience, and your criteria for reaching your goals might be different than your therapist's criteria. So I think it's important to communicate those things. I don't think that should be the only element of how you make this decision, but if you're feeling skeptical and you've been with a therapist for a while, I think that it would be important to reassess what your goals are and talk about maybe the criteria that you're using. And if you feel like your therapist cannot meet you with your goals, and if you feel like your therapist's criteria for helping you toward your goals is not something that's going to empower you, but that's something that's going to disempower you and potentially not actually benefit you and not actually do what you want to do in therapy, like you're paying this person. And so like they might be upset, they might be sad, but who cares? This is your mental health, and that's, you only get one brain. So, I mean, it's sad if you have to go, but it's about you, not about them. So whether they feel upset or not, it matters, but it shouldn't really define the decision. It shouldn't enter into the decision.
Yeah, and honestly, I think that, with choosing any person, whether it's a mentor or a teacher or a coach or, a college or a program, you can't, I don't think I was really coached enough as a kid, even, of that sort of consumer mindset. Like, don't forget, this is your dollars and your time, and you're valuable. I mean, I knew it was valuable, but I also kind of thought, well, this person's an authority figure, so I should listen to whatever they have to say. And if I feel bad, it's my problem. No, it's not all my problem. The other person is a human being that doesn't know everything and isn't perfect. So, it's okay to move on, and don't, do not just make your commitment or your own sense of like, I'm not a quitter, ruin your own psyche. That's not what therapy is for. All right. I think this is the last question that we had agreed upon. And if we have some extra time, we've got about 18 minutes left. Then, if y'all have questions for each other or something else you want to say, you're welcome to jump in. So this is one of my personal questions, because I lived in a few different states in the last year during the pandemic. What is the deal for different US states licensing laws with psychology? And is it different because of the pandemic? How does counseling remotely, long distance, affect us as patients, Dr. Church?
So different states have different licensing rules and requirements. Even through the pandemic, things have loosened up quite a bit in some areas. Some of them have to do with insurance. And so a lot of insurance carriers will cover, where they wouldn't cover in-person sessions, they will cover telehealth sessions, making them more accessible. In my practice, I don't take insurance. And so that's something that can be helpful, is when patients are being reimbursed, they'll get reimbursed for a telehealth session where they wouldn't for an in-person session. In some ways, it makes no sense because it should all be reimbursable. I know that we were talking about mental health being intrinsically also physical health and the parity there. But in terms of state to state, if you have a patient that's moved or gone home to a different state from where you're practicing, it really just depends on your state's licensing board and what their rules are. Now, some states have reciprocity with each other. And so depending on what state you're in, if you're moving to a state that has reciprocity with where your therapist primarily practices, then that should be no problem. Also, a lot of licensing boards, within the profession of clinical psychology, we have a beneficence and non-maleficence guideline in our ethics. And so do no harm and do good. And so if a patient is going to a rural area where they wouldn't be able to access anybody else, and you are their established clinician, that there may be an ability to continue to see that patient remotely. And so really with a lot of questions to do with psychology, even to do with psychology boards, it depends type of situation. I've found that in the type of work that I do, I work with significant trauma patients with high acuity oftentimes. And so with the pandemic, with precautions, I was seeing patients in person quite a bit. I did some telehealth, but I remained doing in person with precautions to keep us safe. There's something about that remote experience that is not as robust, I find, both as a patient with my own therapist during the pandemic, and as a clinician. I love sharing the physical space with my patients. I think it adds a layer of healing and opportunity for engagement that is different and I think more valuable. However, if we are to go without therapy or to have therapy via telehealth, I would say telehealth is a good option, and potentially, you know, with the pandemic changing the way that we do things societally, Zoom calls are becoming quite normative, and you think about upcoming generations, it may be the way that things turn, is to do more remote type work. Now, I'm going to fight tooth and nail against that for myself and my own practice. However, I do think that it is something that can be sustainable and potentially become affordable and more accessible when therapy becomes more established as a remote access experience. But again, in person for me is the way to go, in my opinion.
Yeah, I'm with you. It's very hard for me to do. I'm not a licensed health professional by any stretch, but I do facilitate emotional healing groups through a ministry called Ultimate Journey, and so we go back through our whole lives on a weekly basis and process through some of our trauma together, which I'm pretty new to. In the past few years, I just started. So this is my first time doing a Zoom group this year, and we're it's had its problems for sure, but it's not, it's a lot better than not having it at all. So I'm really thankful for Zoom. I'm thankful for technology. I complain about it a lot, but I also love having this show. So okay, who wants to jump in next and answer any comments about locations?
Well, I'm going to speak very unprofessional, meaning this is like my own personal experience with it. I am not a licensed anything. I'm not familiar with the licensing world. I would say that I've heard, just by being in the circles, and Dr. Church, please feel free to correct me on anything I say, is that there is actually, this pandemic brought up the question of state licensing, and why is it necessary, and does it necessary? That's what kind of like I read and I see in the blogs of like, why should we limit that very important area if people live with where they live, which I'm sure goes to a lot of other industries, but definitely with therapy. So that's one thing that I think is going to, I've seen some petitions that are about a therapist should be able to work anywhere with any patient from anywhere. What's the difference? I agree with it, but again, I'm not a therapist and I'm not familiar with the whole licensing and the whole thing. So maybe there's a reason for it. In treatment centers, most treatment centers stayed open, meaning like all of them stayed open, but I would say most of them kept in person. So I would say also, if you feel like you need, it's different now because it's slowly changing, but if there is another pandemic or spike and you feel like you really need physical, like mental health help, you can go to a treatment center for an outpatient, even for a short period of time. They usually will let you come in person, even though you might not be able to go see a therapist. Those are kind of like my 2 cents about it. Oh, one more thing is that, especially with specialized therapists, I noticed that there is, I don't know what you call it, a trend or run around. I don't know what, and again, I don't know if it's good or bad, but therapists are now getting hired as coaches so they can get through the hassles. I'm not saying that's what you should do. If you really want to work with therapists, you can, but if it's something very specialized, then and you're okay with that, having a coaching relationship with them. That's another way, especially like if you getting referred for like this amazing therapist in a different state that your friend referred you to. So that's one way that I know it's kind of like, again, a growing thing that's going on. Those are my 2 cents of my experience in the past year.
Thank you.
Did I say anything wrong, Dr. Church?
No.
I don't know.
Emerson?
I don't know. This question is a little bit too smart for me, too technical. I don't know.
Well, I mean, it's interesting because you work in an emergency room. I actually had some experience with healthcare in North Carolina this past year, that I was not planned on my part, but I really deeply needed it. And it was really difficult facilitating with my family being in Illinois and me being in North Carolina and my therapist being in California. And I was not able to facilitate good communication, which is one of my strengths. Like, really, that's my main thing, is like networking and being able to speak. But I wasn't in a position to be able to really represent myself accurately because I was having panic attacks, and they were not of a sort that I had before. And it took me a few days to be able to articulate. I actually think it took me like over a week to like articulate what is the actual problem, because I'm having feelings in my body, I'm having feelings in my heart, and I'm having feelings in my brain, and I'm just panicking. I am like in a state of utter panic. And it really highlighted for me in a really personal way, like sort of the aftermath is like, now I have new trauma related to that from the healthcare experience, which I think is pretty common for most people experiencing, you know, I guess what you'd call acute care.
Yeah.
So that's all the questions that we had talked about, except for I think the last one was, maybe it's just me, it's the right therapist and I'm just the problem. We kind of addressed that a little bit, but I just want to open the floor. We've got about 8 minutes. What came up that y'all want to talk about?
Dr. Church, I was really intrigued about what you were talking about.
To address, and I don't know, you guys can.
Sorry.
Go ahead, Emerson. I'll go after you.
Yeah, I was really intrigued about.
I said, go ahead. I'll go after you.
The delay makes it tricky.
I was really intrigued, Dr. Church, about what you were saying about being like the kind of therapist that responds to like oppression, and I can't remember the exact wording, but it's fascinating, the idea of anxiety based on like kind of your personal experience versus anxiety based on your like cultural experience. And I was just curious, how do you determine what is what? I mean, because it can't just be demographic. It can't be just be like, oh, you're of this people group, so this is something cultural. Like, so how exactly do you navigate that?
Well, you know, for me, therapy is profoundly narrative. I want to understand and hear the lived experience and the story of each patient. And so within an intake session, I'm not just asking about symptoms. That takes up very little of my time. And I think the more experienced you become as a therapist, you have these inner check boxes in your brain. You're like, okay, that's the diagnosis. And to me, frankly, the diagnosis is no longer very important outside of, you know, reimbursement for insurance and kind of describing a cluster of symptoms that may qualify for this diagnostic label. But as you listen to the stories of people, within everybody are different levels of identities that have impacted them. And so, you know, having a mindset towards diversity, and myself as a diverse creature in the room with my own, you know, I'm Caucasian, I'm an immigrant, but I'm an immigrant from New Zealand. So there aren't as many oppressive dynamics there. Being a woman is still, you know, numerically not being a minority, but historically through oppression is a minority identity. And so I check my own lenses there, but then I'm looking for those identities within my patients that are known to be linked with cultural pain and trauma. And so a lot of that has to do with historical and intergenerational ways of being treated or systems of oppression. And so, not every Black person in America has anxiety as qualified for by the DSM, but anxiety as a descriptor of a feeling of being nervous and on edge because you're vulnerable in the world, I would say most potentially do, if you're listening to stories. And I would say, everybody is a multicultural being. So most people, especially having gone through the COVID pandemic, have a new understanding of what that visceral anxiety, I have no control, feels like. And so, if you don't have other marginalized identities and you've been through COVID, at least you might have this experience of my life is beyond what I can control right now. And then to think about layers of oppression on oppression on oppression on top of that might give your average everyday layperson a sense of what diversity and mental health and different ways of feeling might look like in the therapy experience. So because you're a minority, it doesn't mean that you're going to meet qualifications for an anxiety disorder. But in the field of trauma, we are growing to understand that trauma can be the root of many of what we see as traditionally diagnosed mental health issues, depression, anxiety, even things like OCD that are historically thought of as more brain-based, like OCD and bipolar disorder, are being re-envisioned through the lens of trauma and trauma response. And so to have an oppressed identity means you have been traumatized in some way culturally. And so it really will depend on the individual in that session, in that intake session, with myself or somebody who comes from that same lens or framework of understanding the individual, to start to kind of parcel those things out, do a power and privilege analysis. And, I think it's very important for me to, I find my patients to be incredibly resilient and self-healing. And so it's my job to give them all the information I have. And so I'll invite them to say, as a bisexual person in the South, do you feel that your sexuality can be contributing to these feelings of anxiety when you're navigating spaces in the world? So, that's something that I will offer. And if it's not taken up on, then it's not taken up on. But I've found a great deal of usefulness and utility to understanding those cultural factors when I'm conceptualizing what's going on with an individual patient.
That's amazing. That's so amazing. Like, that's fascinating.
Yeah, I think like
about it.
Yeah.
I totally agree with you. I think that I know I learned, but I'm very involved in the trauma world, what we're learning, which is like it's kind of like, wait, what is that? Trauma is not only a specific accident that happened to you that really that you were, caught by surprise and hurt you and all of that. The trauma can be your parents not being present, your parents being addicts, your parents getting divorced, that it has the same, if not more, trauma. So it's not an all belief anymore, it's trauma, which is a completely different set of treatment and rules and body and mental health experience. Again, Dr. Church, correct me if I'm wrong, but that's kind of like been my experience.
Absolutely. There's a colloquially termed condition called CPTSD, which is complex post-traumatic stress disorder. So instead of
what I am.
one significant event like a rape or a natural disaster, near-death experience causing this cluster of symptoms, we view it as 1,000 tiny cuts over the course of a lifetime. And it can have identical outcomes in terms of symptomology to PTSD, the same hypervigilance, panic attacks, intrusive thoughts, nightmares, but it's many, many, many experiences over the course of one's lifetime. And oftentimes people will come in with both CPTSD and PTSD. And so, yes, that's something that we are understanding trauma very differently now in the field, and thus beginning to treat it very differently as well.
Which is amazing.
This is wonderful. We're at 4 o'clock right now. I hate that we have to wrap this up. I want to come back for a million more shows with each one of you. Next week, Dr. Church will be back with us. And Chrissy Sackle will also be with us. And we'll have more information on that if you watch our page. Thank you for watching, for commenting. And through the course of this week, of course, you're more than welcome to continue to comment and ask questions, and we'll respond. Thank you, thank you, thank you to everyone.
Thank you, thank you.
Thank you,
Bye.
Betsy. Bye.
Have a good week. Peace and love.
Have a good week.
Bye.